Hi, everyone. Today we're going to talk about ethics in massage therapy in the massage therapy office, whether that is you doing mobile massage and going to a client's home, working in a spa, or working in a medical facility. Now, we're going to pull a lot from Mosby's Fundamentals of Therapeutic Massage. I'm currently working out of the 8th edition, just so that you're aware, but we're also going to pull some stuff from some of the professional associations out there for massage therapy in the United States. So, ethics is the science or study of morals, values, and principles. And we're going to talk about some of those key terms in there, like autonomy, beneficence, non malfeasance. These are all things that you need to know for the MBLEX. But for right now, know that ethics comprises of principles of right and good conduct and how you should or should not behave in a certain situation. For a massage therapist, that means that you're going to be upholding the dignity of your profession. You're going to be client centered. You're going to adhere to laws of your location that you are working in and licensed by. You're going to stay committed to quality work. You're going to respect every client and you're going to remain service oriented. All right. According to your fundamentals book, ethics simply is what is right. Where do we get our ethical guidance from? Like, how do we decide what is or is not right? You need to have a personal sense of ethics as well as a strong sense of self accountability. So, we're going to discuss morals, values, and principles as well as self accountability. But this quote from your book is ethics has social, professional, and personal dimensions. Separating these elements is not easy in theory or in practice. We behave according to a complex and continually changing set of rules, customs, and expectations. For this reason, ethical behavior must be a dynamic process of reflection and revision. We are constantly learning. You're learning right now about ethics, and things you might learn today or learn tomorrow might change how you act or believe that you should act in the future. You should always be doing self reflective exercises and asking yourself if you feel that this is the correct thing to do. All right, so morals are standards by which behaviors and character traits is judged are right or wrong. So these are a lot of times based on how we grew up in our family values, our cultural values, our societal values in the areas that we grew up in, or religious standards. All right, actions can be judged as moral in one culture or immoral in another culture. One that does show up with some frequency in the massage office is whether or not a client feels comfortable with their level of state of undress. We have some religious cultures that want to stay completely clothed, to stay modest. We have some people that grew up in a family or a culture with a lot of shame associated with the natural body. And then there are other cultures, like most European countries, where there's no shame in being completely nude. So there is a sort of freedom in these clients where they don't even often want to wear undergarments in the office versus other clients who want to remain completely clothed from head to toe when you're working on them. So you're going to have to adjust, obviously, what you're doing in terms of type of massage. But this also depends on your morals as well, not just your clients. What are you comfortable with? And are your morals and what you think is immoral or not going to reflect on how you treat these clients who behave or believe differently than you in the office? All right, so values are quite a bit different than your morals. Values are beliefs about what is intrinsically worthwhile or desirable rather than what is right or correct. So these can be based upon beliefs and attitudes that you have at the time, and people don't necessarily agree on what is worthy. For instance, you have someone that comes in and they just love smelling wonderful things, and you charge an extra $15 to add aromatherapy into your treatment. Well, a client that doesn't really care one way or another about how things smell maybe isn't going to buy that service, but someone who really gets a lot of enjoyment out of the atmosphere and smelling a particular scent to get them relaxed is definitely going to pay that upcharge because they want to have that experience because they find value in that experience. Someone who, might absolutely love a musician will purchase their CD or their record versus someone that's like, yeah, that's great, but I can listen to a lot of things on YouTube. Music's not that important to me as long as I'm kind of listening to something. Everybody has different values on what is important to them. If they're going to spend their time watching TV or if they're going to go outside and spend their time gardening, what is important to them at the time? What is going to increase value in their life? And this changes. Your value structure is going to change many times over in the course of your life. Sometimes within a day or two, you learn something, your situation changes, your job changes, you will change your values based on what is going on in your life at the time. All right, so principles are a little bit different. This is an individual's rules or laws of behavior that enable them to behave with integrity. So basic truths or rules of conduct for that person. They're generalizations that are accepted as true and that can be used as a basis for ethical conduct. Do you think that telling a little white lie is okay? Do you think all forms of exaggeration are abhorrent? What are your principles? What do you stand by so that you can behave with integrity and with consistent behavior? All right, so self accountability is truly the cornerstone of all of this. All right, it requires self awareness. If you're not self aware, do you know what your principles are? Do you know what your personal morals are? Are you just doing something or not doing something because you think that your family wouldn't approve or your boss wouldn't like it at work? Is it really coming from an internal place, or are you getting your morals from an outside source? Is someone above you telling you what is right or wrong, and that is how you are dictating your life? Self awareness is knowing how you value things, what your personal principles are, and what your morality is. So, these are things that you will absolutely do when nobody is watching. This is the base of who you are as a person. There's a pile of cash sitting in front of you and no one is in the room with you. Are you going to take it? This is who you are. You need to be self aware of what you value, what your principles are, and what your morals are yourself. Once you can discover that and take accountability for your actions, the other thing to realize going, especially into a service industry where you are working so intimately one on one with clients, is that personal ethics always precede professional ethics. So you are not likely to be more ethical in your professional life than you are in your personal life. You might do things a little bit more professionally or stay on top of things just because you are aware that there are other people watching you, maybe in your attire or how you are writing. Maybe you are a little bit more lazy or relaxed at home versus how you behave at work. That is not the same as if someone feels it's okay to steal in their personal life, they are now also potentially going to steal at work. If the only thing stopping you from doing something that is considered immoral is the fact that you would be fired, your internal morality stays the same, although you are outwardly behaving differently. But not everyone can maintain that mask their entire life. So please be aware when you are doing any type of self reflection, things that you find within yourself that you would like to fix or that you would like to be more ethical about are things that could potentially cause issues with you in the workplace with your professional ethics later on. So, when we're in the massage office, where are we getting our source of ethical guidance if we're not just getting it from our internal moral compass or our principles or our values. We're going to get it from laws and from professional code of ethics and probably from our place of employment. They're going to have organizational policies and procedures in place. So laws, these are legal rules of conduct. These are set forth usually by the municipality that you're in, the state that you're living in, and they are based on shared ethical or moral principles of the majority. Not everybody is going to agree with laws that are in place. Usually these have been voted on by representatives at the time. So laws have a tendency to change based on public opinion at the time, which is why you see such huge spikes in things like women's reproductive health care being accessible versus not being accessible, depending who our current representatives are. These change based on the ethical or moral principles of the majority or the representatives at the time. They are enforceable by the courts. And again, they do differ by municipality. So if you move from city to city, the laws may be different, such as in case of holding a massage office in Michigan. In the city of Port Huron, it's considered adult entertainment, and you cannot have a massage office in your home, or I believe it's within 500 or 1,000 feet of a school or a church. Whereas, up in the thumb of Michigan, you can have one literally, like my office is across the street from a church and is literally right down the road from a school. So that's not a problem because it is viewed differently in my area than what it is in Port Huron. Professional code of ethics, all right, these are established guidelines for practitioner behavior based on our profession. What we do is different from other professions, so how we behave is going to be different than some other professions and how they behave. These inform practitioners of ethical norms and behavior for inside of the massage office, and they supply some direction for challenging situations, which we're going to talk about in this class. We also encourage practitioners to provide excellent service through scope of practice and through client-centeredness, which we'll talk about shortly. We're going to protect those clients, and we're going to provide a means for enforcing desired professional behavior. If you cannot uphold a professional code of ethics, if you're part of a membership like ABMP or AMTA or NCBTMB, then you're probably going to be removed from those associations. There are also organizational policies and procedures of your particular work site. So if you work in a spa or a clinic or in a group practice with other massage therapists, you are bound by that group, that company's policies and procedures. So I'm just going to pause here to say that your fundamentals book has a pretty cool quote. And they talk about the purpose of practicing in the profession ethically is to protect the welfare of the client. But something they say here really strikes home, and that is laws often reflect the minimal standards necessary to protect the public. All right, to protect the welfare of the public. So please know that what is in the law books is the bare minimum of how you should treat and take care of the clientele in your office. Right. So an ethical dilemma, this is a pickle. So when two or more professional duties or the client's rights or a combination of them are in conflict, regardless of what action you take, something of value will be compromised. Whether that's something the company values, the client values, or you value, something is going to go wrong. All right. So, according to your book, Fundamentals, mentoring, which is career support by someone more experienced, or supervision. This is you being monitored by someone with more expertise. Usually in a spa, you'll have a lead massage therapist doing this. In a small clinic, it might be the supervising physician. You can also have peer support, that is exchanging information with other massage professionals. All right. And most importantly, meticulous, objective, personal reflection. It's hard to be objective about yourself, but sometimes it helps to write your actions down and look at it as if someone else had done them, so you can do some self-reflection on what you feel is the correct course of action. You can monitor your own behavior by repeatedly asking yourself whether or not what you're doing is best for the client and if your behavior is ethical. What are you going to compromise on when you sort of get into this situation of, should I do this or should I do this? We hear this conversation a lot when it comes to theft. And it's like, do you let someone starve or do you allow them to steal a loaf of bread? Of course, there are other options. Can someone buy them a loaf of bread? But is it this awful outcome or this awful outcome usually when you are forced to decide in an ethical dilemma? So, as students of this college, you are currently under a student membership with AMTA, but I did want to include ABMP. This is the Associated Bodywork and Massage Professionals. They have a lot of good content out there. They are also one of the big professional affiliations in the industry in the United States. So I wanted just to show you their code of ethics for massage therapists. And their number one is commitment to high quality care. And number two is the commitment to do no harm. This is non-malfeasance, which we will talk about in detail in a little bit. They also talk about a commitment to honest representation of qualifications. This is so important. I always say, when in doubt, refer them out. So if you have a client that is requesting reflexology, but you're not certified in reflexology, you just know a little bit about it because you've been watching, a couple of video clips or reading about it either in my class or another instructor has showed you some tips and tricks in your on ground classes. What ends up happening is, yes, you know about it. Yes, you understand the basics of it. Are you extremely skilled at it? Are you certified in it? No and no. Knowing a little bit about something is enough to make you a little bit dangerous, but not necessarily qualified to do that particular action. Things like deep abdominal massage, or pregnancy massage, or deep intraoral work for TMJD, which is one of my favorite types of massages. These all require a little bit of extra schooling, workshop, certification after you've graduated from a basic massage therapy program. So please be aware you should always be honest about your current level of qualifications to your clients. All right. You also have a commitment to uphold the inherent worth of all individuals. All right. This means that you are going to show compassion and respect for all others where they come from. If you've taken some of my anatomy classes already, I talk about scenarios of, hey, what would you do if this happened on your table? And it's usually something gross or embarrassing that can happen with our bodies. You need to show compassion because a lot of times clients don't have control over this. You need to decrease discrimination and misunderstandings and prejudice. A lot of this comes in line with clear communication and clarifying things with your clients, which we'll talk about in our communications. Right. We also have commitment to respect client dignity and basic rights. This is also part of the law. Commitment to informed consent. Yes, their right to determine what happens to their body is incredibly important. This is also autonomy, all right? I will recognize a client's right to determine what happens to their body. You need to tell them what you are going to do to their body. You need to understand that they might suffer from emotional and physical harm if you don't listen to them and you impose your own priorities over theirs. They are incredibly stressed. They just want a relaxing massage. You know that they have a rotator cuff issue, so you decide to work on their shoulder. Well, maybe they just got assaulted or in a car wreck, and they're very emotionally protective of that shoulder that's been hurting them for a while. And they want to calm down and get rid of some of that anxiety. So now you jump in and you think you're doing a great thing to alleviate some of the physical pain in the shoulder, but all you're doing is heightening their stress and anxiety that they came to you to be able to decrease. So you absolutely have to talk to your client, communicate with your client about what you are going to do, and they have to give you enthusiastic consent on what you are going to do to their body. All right. Commitment to confidentiality. This is an actual part of the law. We'll discuss this in detail later on when we talk about HIPAA, but you are not going to release any of your clients' private information to anyone else without their express consent or some type of subpoena from the court. Right. Commitment to personal and professional boundaries. Yes. We're going to talk about boundaries separately in another lecture, but yes. Commitment to honesty in business. You're going to hear the term veracity referring to honesty. You are going to have integrity. All right. You are not going to accept gifts or major benefits intended to influence a decision. Like, maybe they're a hemophiliac, or maybe they have some type of medical issue that means that you can't do deep tissue on them safely. All right. And they're like, hey, I'll pay you an extra $100 if you do it anyway. Well, okay, great. You're, potentially setting yourself up for a lawsuit when you physically hurt them, as well as being unethical for taking that bribe. All right. Commitment to professionalism. You are going to commit to clear and honest communication with your clients and your colleagues. You are committing to be a person of integrity in your professional environment. All right, as students at college, you are part of the AMTA right now as a student member. I have been a member close to 20 years with AMTA. This is their code of ethics for massage therapists. They have their principle of ethics. This is aspirational and inspirational model standards of exemplary professional conduct for all members of the association. Okay, so you're going to demonstrate commitment to provide the highest quality therapy or body work to those who seek your professional service. You're going to acknowledge the inherent worth and individuality of each person, demonstrate professional excellence through regular self assessment of your strengths, limitation, and effectiveness by continued education and training. But it's not just this. You need to also know things like when you are getting burnt out, or why I picked up teaching to let my thumbs heal for a little bit, because body mechanics is a thing. And if you do too many hours of deep tissue for too many decade and a half plus years, you can start to get overuse injuries. I recognize that in myself. I stopped doing as much deep tissue, particularly with my thumbs, and I decided to take up teaching and come back a little bit from massage for a little bit. You need to acknowledge these weaknesses so you do not start giving subpar performance to the clients that you are seeing. All right. You need to acknowledge the confidential nature of your professional relationship. You need to project a professional image and uphold the highest standards of professionalism. We'll get into this a little bit later, especially when we talk about being inappropriate in the massage office, because the professional image may be different to everybody, right? We've got different morals and values. So that might also relate to how we feel about professional image. You're also going to accept responsibility to do no harm, non-malfeasance, to the physical, mental, and emotional well-being of yourself, your clients, as well as your associates at your business. All right, so the rules of ethics, these are mandatory and direct specific standards of minimally acceptable professional conduct, okay? So you are going to conduct all business and professional activities within your scope of practice and within all legal requirements. You're going to refrain from engaging in any sexual conduct or sexual activities with your clients. You're going to be truthful in advertising and marketing, all right? You're going to refrain from misrepresenting your services or qualifications in any way. You're not going to use the AMTA membership name, logo, et cetera, in any way that's unacceptable or any activity which would violate confidentiality commitments or rights of the association. So this is an example of those professional ethical guidelines. This is above and beyond you. Now you are not going to misrepresent the association or what the association represents with your conduct in or regarding massage therapy. Right. So I brought up client-centered service before. So what does that mean? What are practitioner duties? This is placing the client's interest first. They are client-centered. We are centering in on that client. Do no harm to them, all right? Non-malfeasance. Do as much positive good as you can. This is beneficence. And you are always going to obtain informed consent. These are the things that are the cornerstone of what you need to do, your duties as a practitioner. The client's rights, they have a right to have their interests placed above and before the practitioner's interest, right? Like the person that just wants a nice Swedish massage, they just want some effleurage to relax, have some anti-anxiety. You want to talk about their rotator cuff injury, and you want to do deeper stretching and work on their shoulder. Your interest in helping them fix their shoulder that they've been complaining about does not supersede their interest in just having a relaxing day. All right. You also need to allow them to have an active role in directing the course of treatment. No means no. I guess means no. Maybe, probably means no. You need to have enthusiastic consent like you do in other areas of your life, all right? The client has the right to autonomy. That is to maintain the ability to make decisions about their own body. All right, these are 10 main ethical principles. You can definitely pause here to read them out, but this is respect, client autonomy, veracity. This is the right to objective truth, proportionality. All right, the benefit needs to outweigh the burden of treatment here, non-malfeasance, beneficence, confidentiality. Justice, this is the principle that ensures equality among clients. Fidelity, we're building a trusting relationship by keeping our promises. Like, hey, I'm going to show up for a massage at 2. Well, great. I'm going to show up to give you a massage at 2. You both better show up by 2. All right. Fiduciary duty. This is an obligation to maintain trust and the legal responsibility to act solely in the best interest of another party, in this case, your client. Right, standards of practice. You're going to hear this term a lot. They direct the quality of care that you're providing and also a means of measuring the quality of care. The quality of care might differ a little bit depending on what type of facility you're in, like spa versus like a more medical facility versus a cruise ship, which is kind of churn 'em and burn 'em in that type of environment. It depends on where you work, but for the profession as a whole, it's going to be respecting the client, respecting their autonomy, giving them access to their files, providing them privacy and modesty, these type of things that we've already been discussing, but these are the bare minimum standards that you need to adhere to. So I'm going to let you pause to read this or look at it in your fundamentals book. But there are principles from the Code of Ethics that form the basis of the standards of practice for massage professionals. And this is the same stuff that we've already discussed, which would be respecting all clients and colleagues, performing only services that you are qualified to do, respecting the scope of practice of other healthcare and service professionals, though, is new. So if something is out of your wheelhouse, and someone has diagnosed a client with something, it is out of your scope of practice to diagnose. So this is something that you are going to leave to that physician. If it is a particular exercise for an issue a client might have with their iliopsoas, and the physical therapist has told them to do something in particular, it is out of your scope of practice to say, hey, no, that physical therapist is wrong. You should be doing this instead. You need to stay in the lane of acting as a massage therapist. You need to acknowledge your own limitations with personal skills. You also need to use appropriate caution when working with any individual who has a specific disease process and seek supervision by a licensed medical professional when needed. We see this a lot of times in oncology massage when we need to make sure that we are adhering to what the physician recommends to not exacerbate any symptoms. Maybe we want to focus on alleviating, nausea if the client is on chemotherapy, or we need to avoid areas of radiation rash if they're currently taking in radiation. Those type of things need to be aware of. And you also need to be adequately educated and understand the physiologic effects of the specific massage techniques. All right, you need to know enough about anatomy and physiology to know whether any application is contraindicated and to ensure that you are giving them the most beneficial techniques that are applied to any given individual, which is why it's really important to know, hey, if someone comes into you for a COPD treatment and they want help having a productive cough, we're going to know about the cupping technique on the posterior thorax. And we're not just going to do light effleurage, on the intercostal muscles or on the neck, which might be relaxing, but nowhere near as effective and not the appropriate treatment that they're looking for. You need to know about the body. You need to pay attention to those anatomy classes, and you need to know the particular types of massage techniques that make sense to work in those particular body systems. Right, you're going to be avoiding false claims about the potential benefits of the techniques, okay? You're going to acknowledge the importance and individuality of each person, and you're going to work only with the informed, enthusiastic consent of a client, and you're going to professionally disclose to the client any situation that might interfere with the massage professional's ability to provide the best care to serve the client's best interest. All right. I used to specialize in a lot of tension headache, and migraine work. Because of my thumbs, I don't do the suboccipitals very well, and I don't agree with using tools in that particular area of the neck. So I am currently declining any client that is coming in and asking for those, because while I know how to do the massage, I used to specialize in the massage. I know that with my hands at this time, I cannot perform the quality that they want. I can do other things, but if that is something specific that they want, is that deep suboccipital work, I need to refer them to a different person at this time. So please professionally disclose if they want a prenatal massage and you don't have a lot of training. If they, their whole family wants to come to see you, but you're scared you're going to lose that client if you say no to massaging other members and one of them is a child, and you really don't know anything about or don't want to do any type of pediatric massage, maybe you should lose that client, because it's really unprofessional to accept someone that you don't want to work on or don't have the ability to treat as well as somebody else could have in your position, and give them a subpar treatment and still take payment for it. You also need to show respect by honoring their process, how they want to go through the massage process, and following all of their recommendations, being present and listening. That doesn't mean just asking your intake questions at the beginning. It means you don't zone out while you're working on them, thinking about something else. You need to be on time. You need to drape them properly and snugly so that they feel the draping is actually there. You need to avoid the no touch zones or the cautionary areas, and you need to customize your massage to address the client's needs. I know a lot of times at spas, they have a particular set routine for a treatment a lot of times. And that is one thing. When they have like a signature massage and then they follow this whole routine that's exactly the same. But if you are working in a private practice, while it's great to have signature moves, you need to pay attention to whether or not a portion of that is either going to annoy the client, like they don't want their feet done, or they don't want, an area of their legs touched because they have fibromyalgia or maybe a rash. You're going to have to customize that massage to that particular client's needs. All right. The client can choose to be fully draped or clothed if they want during the treatment. You're going to do compression. And this goes back to our earlier discussion of morality. You cannot undrape a client's breasts unless specified by referral from a qualified medical care professional, and the massage professional is working under the supervision of a medical professional. This was in fundamentals. I know this varies from state to state. You might get requests either from pregnant or breastfeeding women, or especially post-surgical, especially after a mastectomy. It is appropriate to get information in the case of post-surgical massage from the physician, but please be aware these are instances that this would be acceptable for you to do this. And you do not undrape, of course, the genitals. There are some very specific things like medication canisters that could be placed in the scrotum in cases of testicular cancer, but these are like less than 1% of clients, and you're probably going to be someone that specializes in medical at that point. And so this is above and beyond what we're covering today. Just letting you know there are some caveats to these statements if you want to go into the medical side of things. But in general, and especially in things like spa massage, these are the standard of practice rules, all right? And no matter where you are at in your career or who you are working on, above and beyond everything else, you are going to provide a safe, comfortable, and clean environment for your clients to be worked on. All right, so we're going to maintain clear and honest communication with the clients. We're going to keep client communications confidential. We're going to conduct business in a professional and ethical manner. All right, we're going to follow city, county, state, national laws, and we're going to charge a fair amount for the session. Now, if you have some amazing technique, some protocol that you've created or that you've become specialized in, something like lipomassage that has like a set standard for that particular service, absolutely charge higher. Okay. But we don't want to set an extremely low price, lowering the standards of the industry and not giving you appropriate payment for your service time, the wear and tear on your body, and of course the education that you had to go through. Gratuities are absolutely appropriate, but you don't want to ever do anything that would influence anyone about a referral or decision or about a treatment, making them feel coerced or you changing your own principles in exchange for this money. You are absolutely going to keep accurate records, all right? And it is suggested that you review them with the client for accuracy. You do not engage in any sexual conduct, which we will discuss later. You're going to avoid affiliation with any businesses that use any form of sexual suggestiveness or explicit sexuality in advertising. We'll talk about this later as well. This happens a lot when we have the potential for sex trafficking in these type of businesses. You're going to practice honesty in advertising, promoting your services ethically. You're not going to make statements that they do miracles that they do not do. And you're going to strive for professional excellence through regular assessment of your personal strengths, limitations, and effectiveness through continuing education and training. Back to the cornerstone, self-accountability. You're going to accept the responsibility to yourself, your clients, and the profession to maintain physical, mental, and emotional well-being, and to inform the clients when one is not functioning at full capacity. All right. I've given you my example of my thumbs twice, but what if you're really stressed out? What if you just had a family member die? Okay, you are focusing on that. Work through your grief. Don't allow your grief to come into your client's sessions. Do you have a right to your grief? Absolutely. Does your client need to show up and pay and receive an outpouring of your grief rather than coming in and having a place to relax themselves, potentially from their own grief? No, we need to take care of ourselves as practitioners first before we can effectively take care of our clients ethically, okay? You're going to refrain from using any mind-altering drugs, alcohol, or intoxicants before or during professional massage sessions. All right, don't take anything during your session. You don't want to be ingesting anything or putting things near your mouth after you've touched their bacteria-ridden body. This does not include any psychoactive medications that are prescribed to you. Please continue taking any of those medications while you are a massage therapist. We're talking about things like, you know, acid, alcohol, copious amounts of marijuana with high THC counts, these type of things. All right. You want to maintain a professional appearance and demeanor by practicing good hygiene. This is for multiple reasons. And dressing in a professional, modest, and non-sexual manner. This one is up a little bit up to personal interpretation. What you find professional and modest may be completely different from what another practitioner finds professional and modest, or what your client finds professional and modest. So this is where we have a little bit of wiggle room, but it cannot be something that is sexually suggestive. All right, you're going to undergo a periodic peer review. And you're going to respect all pertinent reporting requirements outlined by legislation regarding abuse. All right, I know you guys are ready to go. We are on the last slide. So we're going to report to the proper authorities any accurate knowledge and supportive documentation regarding violations by massage professionals or other medical or service professionals. Are they operating without a license? Are they giving inaccurate or dangerous advice to your client? Another thing is avoiding interest activities or influences that might conflict with the obligation to act in the best interest of clients. Well, what does that mean? So, a conflict of interest is a situation in which an entity or individual becomes unreliable because of a clash between your personal or self serving interests or your professional duties and responsibilities. So, what this means is if you work for a spa and they have their set retail products, but you've also joined up this pyramid scheme of retail products that you need to sign people up for, well, great. You've got this clientele coming in ready to sell to. So instead of selling the massage products from the spa, every client that comes in, you offer them a little bit of extra free service of what you're trying to sell to get them signed up. This is a conflict of interest with your company, as well as what the clients are coming in for. Another thing would be professional continuing education courses. If you teach the course for knowledge, that's great. But if you're teaching a course specifically about the use of a particular product to sell that product to the students paying for the class, that is a conflict of interest. I know it's not allowed in NCBTMB. I don't think it's allowed in AMTA either. So just be aware of things like that. We don't set things up to sell things for our own personal monetary gain when we are acting in the best interest of our students or our clients in any particular professional situation in the massage industry. All right, guys, that's all I have today for ethics and principles. I know it was a lot. I will see you guys on the next one.